Hello, 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 everybody. How are you? Good afternoon, good evening, and good morning from whatever part of the world you are watching or listening to this program. If you can hear me, please type I can hear you in the comment section. I just want to be sure that I am not speaking to myself. It's a beautiful day. It's a beautiful day. Although I am used to talking to myself, right? Sometimes. So I would like you to please type I can hear you in the comment section so that we can know we're not speaking to ourselves. Yes, I am broadcasting live from Atlanta, Georgia. And before we start, I just want to make sure. Um, let's see. Give me one second. All right. Yes, yes, yes. Welcome, 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 welcome. I see you. Thank you. Thank you. Thank you. Please like and share this broadcast because there's somebody on your contact list who would definitely benefit from this. So let's get started now. I have a very important personality here, a very powerful guest, a medical doctor, a surgeon. I will start by, first of all, telling you about him. He has a very long profile, but we will just go straight to the basics. So, welcome everybody to another episode of the Morale Booster with Dr. John Ughulu. The Morale Booster is a platform for entrepreneurs, career professionals, leaders, and the general public for giving back to the society through coaching and mentoring. Experience, they say, is the best teacher. So this program is currently being sponsored by Main Seed Consulting Group. And for bookings, adverts, sponsorship, inquiries, please feel free to reach out to us. You would find our contact details um, on the screen. It would be available for you from the beginning to the end. So, okay, I see people saying they can hear us. No problem. Thank you. Thank you for joining us. Yeah, so before I introduce our guest for today, I want you to please like and share this broadcast. Like and share this broadcast because you might just be saving the life of that one person who has been waiting for a lifetime to hear this message. Like and share this broadcast. All right, so our guest for today is Alejandro Badia MD. And let me ask him if I pronounced the name correctly. You are on mute. Unmute yourself, sir. Did I pronounce your name correctly?
Yes, you did. Badia. Yes.
Badia. Okay, Alejandro Badia.
Alejandro, excellent.
Awesome, awesome. All right. So Badia studied Dr. Badia studied physiology at Cornell University and obtained his medical degrees at NYU, where he also trained in orthopedics. A hand fellowship at Allegheny General Hospital in Pittsburgh was followed by an AO trauma fellowship in Freiburg, Germany. He runs an international hand fellowship, served on the review board of a hand surgery techniques journal, and previously organized a yearly Miami meeting for surgeons and therapists devoted to upper limb arthroscopy and arthroplasty. This international meeting was held at the renowned Miami Anatomical Research Center, which Badia co founded in 2005. Now, let me go straight to some other very important uh, topics and details you need to know about him. We might not be able to say everything right now. In 2010, he launched Ortho Now, the first immediate orthopedic care center in South Florida, later franchising the concept, which can now be licensed to orthopedic colleagues and healthcare systems, and currently seeking the optimal strategic healthcare partner. So he's an entrepreneur as well. Who says a medical doctor cannot be an entrepreneur? So let's talk to Dr. Badia today so he can enlighten us and even tell us more about who he is. So welcome on board, Dr. Badia. How are you?
I'm wonderful. Thank you so much, Sean, for having me.
My pleasure. My pleasure. You know, you have a very wonderful profile. You know, a surgeon, an author, an entrepreneur. So, can you tell us how were you able to make this happen? Because you know, I've had to speak with a lot of doctors who feel and think they cannot do business because of their profession. So, tell us, how did you make this happen?
I realized that the healthcare system is woefully inefficient, and it was really driven out of frustration. I founded Ortho Now because I noted that all patients who came to see me with a problem of the hand, elbow, shoulder had already been somewhere. And that other place usually was a waste of time and money to the patient, money to the referral source, the employer, the insurance company, and money to our entire healthcare ecosystem, which is going to be approaching 20% of our GDP. It's twice as expensive as the next country in line.
Right.
So I didn't do those things because I said, okay, I'm not busy enough as a surgeon. I didn't start Ortho Now honestly to make money. On the contrary, it's really cost me a lot of money. And because of that journey, that's what led me also to write the book, because I felt the public needed to understand. So all of your listeners, if you're wondering, why is it so hard for you to see the right doctor? Why do you have to go through these hurdles and get these authorizations and delays, and you get these bills that I don't understand the bills I get with my own medical care. All of these things, I try to make sense of that in the book. And my biggest challenge is getting the book to be really awareness amongst the public, and whether it be a CNN or a Wall Street Journal, somebody picking it up, because until that time, it's folks like yourself, Dr. Ughulu, and thank you for the opportunity. It's really only through communication like this that people are going to know about the book, and consequently the problems with our healthcare system, and that's why I did it. I want to be clear. My main love and the thing I think I'm good at is being a surgeon. The other things I did because I felt it just needed to be done.
All right, right. That's great. You know, typically most entrepreneurs they get into business initially for the money. You know, money is important.
Yeah,
We're not saying
sure,
money is not
of
important.
course.
I typically say immediately after oxygen, the next important thing is money. You know, a lot of
And water.
entrepreneurs and well, yeah, you know, they get in for the money. Then later on, they realize that it's more purpose driven. But you, from the beginning, you said it's purpose driven. You did not get in
Yes.
for the money. That's a beautiful one. That's a great one. Thank you so much for
Yeah.
all you do.
Thank you.
Yeah. So tell us about your book. You have a book that you are working on right now. Can you please tell us about the book? What's the title? Do you have a copy with you there?
Yeah. No. The book. I won't say I'm working on a second edition, although I have to admit I've been thinking about it. People are pushing me because there's a lot of developments. The book is called Healthcare from the Trenches. So you see, I'm standing in a trench with my scrubs on and a shovel,
Yes.
because
Yes.
you really feel like when you're in healthcare, and this is not the Dr. Fauci's of the world and the Dr. Guptas who are all very esteemed physicians, but they're in a different area. They're not seeing patients every day, fighting the battles that all physicians and other healthcare uh, uh, providers. I hate the word provider, particularly for physicians. It's an insurance word, whether it be nurses or technicians or allied or health professionals, like I work a lot with PAs or nurse practitioners. All of us who are touching patients directly go through a lot of struggles, and so the book, the subtitle is an insider account of the complex barriers of U.S. healthcare from the providers, in quotation, the providers and patients' perspective. So
Okay.
I
Okay.
wrote this with 26 contributors. They each have small area. I wrote 90% of the body of the book, I would say.
Okay.
But it's to point out the problems. That's the goal of the book.
All right. So it's titled Healthcare from the Trenches. So for those
Correct.
of you who are listening via podcast, and those of you who are watching us now via Facebook and YouTube, the title of the book is Healthcare from the Trenches. All right. So where can they find this book to buy?
Main place is Amazon. I in some discussion possibly with publishing houses to get, but most people get their books now from Amazon. So
Yes,
uh,
yes. So,
you can also get it online with Barnes and Noble. But Amazon is quite easy. They have a Kindle version for those
okay.
of you who like electronic. For folks like myself, probably I imagine like you, Dr. Rula, is we want to curl up with the book and fold the pages
Oh yes. Oh
when
yes.
you want to talk to somebody about that or argue with me about it. And yeah, I just did that yesterday with um, I want to shout out to a Dr. Pepe Granite. Pepe's in her mid 80s, still doing family practice,
Okay.
and she wrote a book, um, which is up there. And we met yesterday, and we talked about our respective books,
Oh, okay.
and she had a bunch of inserts in each of the pages of things that she wanted to speak to me about.
Oh,
So it's yeah.
yes, 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 yes. It could be fun, when you are engaging with authors about,
Yeah.
what's in their books, and I love to do that a lot. I ask a lot of questions. So, yeah. So, for those of you listening, you can purchase this book on Amazon. Go right now and buy this book. It's available for purchase. And if anybody wants to reach out to Dr. Badia, his website is currently being displayed on the screen for you. You can always reach out to him. Is that your website? Is it correct?
Correct. Correct.
Okay.
That's my website, and there's a link there to the book. There's a website for the book with videos describing each chapter.
Oh,
So
okay. Okay.
it's easier to remember one website. We all have so many sites. They can even find Ortho Now, which we'll talk about, I'm sure, but they can even find Ortho Now through my website.
Oh, okay. Great, great, great. Yeah. Now, apart from you having that book, right? What are your plans for the next 5 years based
Hmm.
on what you do, but with your book and your practice?
Yeah, that's actually a very easy question because I want to immerse myself more in the clinical part in being a hand surgeon, upper limb surgeon. That's like I said, that's really what I'm good at. The business, like many physicians, I do struggle, but I had a concept, so I'm hoping not. I hope it doesn't take 5 more years. It's been a while. I want to find the right um, healthcare company or say a company that wants to get into healthcare more. For example, you read about even Amazon tried this, and I had some communication with the chief person who's no longer with them, and that actually failed. So I imagine they'll try again. So I'm hoping to find a company like that. Could be Walmart, could be CVS Health, that wants to really bring retail medicine, make healthcare really accessible for people, including our app, which is one. Our Ortho Now app has won several awards. So that's what I want to do so that I can concentrate more on medicine. And I'm about to open a second small office in New York City, which is my roots,
Okay,
John.
great.
So and then I did a surgery on Tuesday in Washington, D.C. It was my first one. So I
Wow.
flew to Washington Monday. I saw the patient. We did the surgery almost in the shadow of the Capitol building. And then I flew back home that night. So that's what I'm hoping to more. And then the other thing I really want to do is expand the missions. I do some medical missions,
Okay.
uh, and I've been trying for 2 years to organize one in Ecuador, but the pandemic has postponed the
Yes.
site visit. So I've done this in Ghana, in Western Africa, of course. I've done it in Guatemala in the past. I've done volunteer stuff in Bolivia, Peru. So I'm looking forward to doing that in the next 5 years, probably every 3 months or so. That would be I would really like to do that.
Oh, great, 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 great. Okay, so now from the, let's go back to your book because that's one of the
Yeah,
major reasons why we're here today.
yeah.
What are the key takeaways? What would the readers benefit from reading the book generally?
Well, they'll better understand the hurdles that we go through to provide the care, right? You would think you just go to a doctor, they make a decision, you follow that, you either get better or you don't, and then we pivot. But no, the reality is nowadays there's many barriers to get to the right type of doctor, and even when you do, every time with most insurance companies, every time I make a decision, I have to have it authorized,
Okay.
approved. And when there's a whole section in a book called authorization is a four-letter word
Right.
because we know it's many more than four letters, but it really it makes those physicians really lose their cool because you're asking somebody who doesn't know anything about the field to approve your decision. And the problem is not only that the whole concept is really ludicrous. Let's be very honest here. But on top of that, that causes delays, and I believe those delays are intentional, right? And when there are delays and multiple steps, that increases the cost.
Right.
So we all are concerned about the cost of healthcare, but if we could minimize these unnecessary steps, maintaining oversight. I'll always say that there's in every profession there's bad apples. There's people who do things maybe they're incorrect, inappropriate, or only to make money. I think that's the minority, but we can have oversight without interference.
Okay.
Oversight without direct interference. So the book gives you many examples like the one I just gave you about authorization as to why. And you realize this when you're in the trenches. You can be a very famous professor at a medical school and not realize this as much because if you're in the private practice and every day seeing patients, you realize, and this is one of the reasons we're seeing this so-called physician burnout. I talk
Right.
about this. I don't like to use the word burnout. Burnout means that you're not very resilient. No, I think we describe it as moral injury. It is morally injurious to a physician to have to request permission to do a treatment and to often be denied, and you are the advocate for your patient. So if
Right.
somebody is telling you that's very difficult for somebody who took an oath and spent, in my case, 14 years of education and then training. That's very difficult to swallow with somebody who's sitting at a desk in another city.
Right, right,
That's
right. I get that. And what you're doing now is brilliant. The main thing is just to get people to read this book and understand those concepts and understand those
right.
challenges that are in the book. So what plans other than the book? Because the main people who need to take decisions on this issue might not have access to this book. So, what plans do you have to reach out?
Well, we do a lot on social media where we're talking about the book and about the principles. The thing that I'm really doing for the first time in my life is I'm really trying to establish relationships with some of our legislators.
Right.
I'm very happy to say I just had a breakfast in Miami with Vernon Buchanan. Vernon Buchanan is
Oh, yes.
a congressman who will probably be the chairman of the House Ways and Means Committee this year. And if anybody who follows government knows, that's the big committee in Congress. Ways and Means basically figures out the ways and the means to pay
Right.
for something. So they are in charge of healthcare spending.
Right.
And I'll tell you, he really understands. He has my book. So does Senator Bill Cassidy, who is from Louisiana. He is a gastroenterologist. He's a physician. His wife is a surgeon, and he's in Washington fighting for all of us. And these guys get it, and so do many non-physicians. I think things have gotten so bad with healthcare that, and I'm sorry for anybody in, say, the insurance industry or the big hospital healthcare system who's listening. We haven't done a great job, communicating the
Right.
physicians, the people who actually provide the care, because
Right.
the person running the insurance company, most of the times doesn't know a lot about medicine. So, and I understand, I'm a capitalist. I was born in Cuba. So
Oh, okay.
I believe these companies should make good money. I have no problem with that. I have a problem, though, when they're making money at the expense of
Off.
people not getting the care they
Exactly.
receive. And they're getting the care they receive in a much more expensive manner, that if we didn't do it that way, we'd actually have so much money left over for the people who need it.
Right.
For a
Right.
less fortunate society, where you're going to have in any society. I mean, even in a poor country, there are really poor people. In a rich country, there are, moderate and poor people.
Right.
And everybody needs access to care.
Right. That's true. That's correct. And that's what I keep telling people. It's expensive to, if you do not have plenty of money, you wouldn't want to go to the hospital, and that's not ideal.
Yeah.
It's not a great thing to do, and I'm glad you are doing something about it. And I know there are so many other doctors out there who are also doing something about it, and
Yes,
we
there
would
are.
love to have them on our program just to reassure people, because right now, you know the pandemic has increased the level of depression globally. It has increased the
Yes.
level of anxiety globally. It has increased the level of domestic violence and even hunger globally. And if people, ordinary citizens, those who are not wealthy, do not have access to medical care, then why are we leaving?
Yeah. That's the point of society, right? Is to have specialization so that people work together. Otherwise, we can just all go, and live in the woods and live separately and fend for ourselves. We have people who are expert, and yes, but our hands are really being handcuffed. Um,
Right.
the physicians, that there is an incredible frustration, and you should be aware. Your listeners should be aware that people are retiring in droves. I mean, it's
Yes.
not just the police officers who are quitting, for similar reasons, not as violent, thank goodness, but physicians are. Look, I myself am cutting down now. I'm doing it in a way that I can also have more time to give back, because I want to go
Right.
and give back. But at the same time, I'm not seeing as many patients as I used to, and I just don't. There's only so much frustration you can take. So I
Right.
worry about the doctors who are coming in now. I really am very worried about the future.
Right, right. I get it. So now, what's your advice for that doctor who has been going through this frustration that, you know, doctors go through, and they feel they can't do anything? What's your advice for that person out there right now?
Yeah, well, the advice is actually quite simple. We need to collaborate more. So,
Exactly.
there are going to be people. I can tell you 10 things that I'm terrible at, but one thing I think I'm good at is communicating. I took the time to write this, and I don't get a lot of collaboration from my colleagues. I don't get a lot of people saying to me, "Hey, what?" There's a very well-known physician. I've tried to collaborate with him. They call him D Dog or something. I forget. He's a very interesting guy. He has millions of followers, and I reached out to him, and he was very nice, but there was not a real sense of, okay, let's roll up our sleeves together. Let's find like-minded physicians who are willing to put themselves out there and willing to sometimes to risk, because there are some risks about this, for our own careers even. But we don't collaborate much. And the title of chapter 4 in my book is called Cats, Colleagues, and Collaboration.
Right.
Cats is because if you speak to anybody, especially non-physicians who work with doctors, they say it's like herding cats to get us to make a decision. One of the reasons that Ortho Now has not taken off sufficiently is that if there's a group of 10 surgeons who would benefit from having 3 or 4 ortho nows in their community, there's always a couple who will, say, well, I don't see the reason for that. And then nothing happens. And this is what's happening in healthcare. And I can promise you, the people in the big healthcare systems and the insurance companies all know, and they all kind of laugh about how doctors are when they're, having a scotch at the end of a tough work week.
All right.
Because I've been there, I've heard them speak, because I'm sometimes one of them, because I am on sort of the administrative level occasionally, and we have to realize that not all the doctors are going to be very good, as you said at the beginning, with business, but listen, that's because they're doing what they're supposed to be doing, being physician and working hard to take care of their patients. So we should not take advantage of their altruism, of their sense of purpose. And that, I think, adds to the moral injury, is that when somebody knows they're doing the right thing and they're not looking at the clock, because when you get paid some code to go see a patient in the middle of the night at a hospital, you're doing what you need to do. You hope you can do it in half an hour, right? But it may be 3 hours that you're there, or 4 hours, and in the end, that economically that doesn't make sense. But that's okay. Most 98% of physicians aren't thinking that way. They're doing what they have to do. So let's not take advantage of them, because if not, just like the police officers, just like many other sectors, people are going to get tired of it. And it's starting to happen. So I have my concerns.
Wow. So it means, like you mentioned something about risk. So which means there are risks for physicians to come out there and speak about it. And you are embarking on this journey, and you're ready for that risk, right?
I am, because I've been in practice long enough. And also about 10 years ago, I realized that I can be what they call out of network, meaning patients can see me if they have insurance, but many times they will have some out of pocket, because me and many other doctors just realized what the insurance company is willing to pay us is really what they think it's worth. And of course, it's almost always going to be less than what it's really worth. So I don't see as many patients. I also have the luxury of being in Miami, which what was always an international city, but now after the pandemic is a super international dynamic city. I mean, the people from Silicon Valley or New York area who've come down here. So I'm very lucky that my practice is a little bit different. I'm frankly not that concerned if so many insurance companies blackball me. It's like a John Grisham novel. I hope I don't have to check the brakes on my car, when I leave my medical center. But you can ask Mandela or anybody who's tried, or Martin Luther King, who's tried to change the system. There are some risks.
Right.
But I'm not alone in this. I mean, not at all. It's just that a lot of physicians for one, a lot of them. More than 85% of physicians are now coming out of medical school are employed.
Right.
So they're not doing like I have now. I'm solo, which is really rare. But even in a group practice, most physicians now are actually being hired, a salary, just like any other. There's not the traditional private practice. And so those folks are going to be a little more afraid to speak up.
Right.
And I hear stories about the contracts they sign with these hospital groups, and they're very onerous. I mean, I had an amazing discussion again with Dr. Granite yesterday. She wrote articles in the early 90s, late 80s.
Okay.
That echoed and forecast what we're going through right now. It's quite amazing.
Wow. Now, okay. Someone asked a question. Let's just pull up that question and see if okay. Hidiat Symbol. She said, what can be done to save the health future of a common man? A common man. I think she's probably referring to someone who does not have a good job, a good, source of livelihood. So what can be done? to save that.
Take take the same level of interest of healthcare inefficiencies as an issue as we have with other societal issues, whether it be police brutality or Black Lives Matter or save our ecosystem. Have that level of interest and talk about it. Talk about it on social media. Okay, I want to hear a little bit more than just what Kim Kardashian is wearing. Okay,
Exactly.
we have
I
to
like that.
use, I mean, all these things are fun. I succumb to clickbait all the time. Okay, I like pretty girls like the next guy. Okay, but what's really important, really, is these issues in society. And we've done a lot to make some headway. I'm hoping, we make some headway in some of the other issues I mentioned. But with healthcare, people just have come to accept it and accept that their insurance company denies them this and look at what your physician is being paid to do, your aortic valve replacement in your chest, to open your chest and put in a new valve and save your life. Look, take interest in what Medicare or Blue Cross is reimbursing that person for that level of work, and certainly be very aware of the liability issue. Doctors, it doesn't mean that we shouldn't get sued. I hope some of you saw another podcast called Dr. Death. Okay.
Yes.
There are bad apples out there, but
Right.
the amount of frivolous lawsuits against physicians doing their best, medicine is not 100%. And the public needs to understand that. I can tell you many surgeries I do that I know is well over 90%, but there is nothing I do that is 100% successful for every single patient.
Right.
I mean, I've done a carpal tunnel release, which is a really routine operation for a hand surgeon. And the patient comes out and goes, I still have numbness in my hand. What's going on? And honest, my answer is, wow, I don't know. I mean, I definitely took the pressure off the nerve, but there are physiologic, metabolic issues, all right, of neurotransmitters, et cetera, that we understand at a science level, but sometimes it's just unclear. And if somebody has an untoward or adverse result, it doesn't often mean the doctor did something wrong. Some people say 5% of our healthcare costs is defensive medicine. Okay, I talk about that in the book about tests being ordered just to cover their butt. The doctors don't want to do that. Doctors want to order the right test that is efficient, indicated, but sometimes many doctors are worried about that, and there has to stop being an adversarial relationship between our patients and us. When insurance company delays or doesn't authorize something, please realize we're in the same boat.
Right.
I rarely see a patient get angry about their insurance company. It baffles me. Don't you realize you're paying them the premium? You're not paying me a monthly premium. If you are, please write to Dr. Ughulu and send me your monthly premium. I'll do all the surgery you need. But nobody gets upset about that. It's quite amazing.
Yeah,
and I don't even want to talk about a wide receiver that makes $30 million a year. If you used the word several times, less fortunate, poor, and you're the biggest fans of these sports, let's understand as a society, we need to get things under control. It shouldn't just be our entertainers and athletes who make this, and the person cleaning, the hardworking woman who cleans my office every day. I mean, we all respect what she does, but they cannot be paid less.
That's true. So basically, you are saying people out there have to be more intentional about, communicating what they want, the changes they clamor for, the changes they want. They have to be more intentional about speaking up. So those who are listening via podcast, Dr. Badia is encouraging everybody to make sure they speak up. You can be the voice, you can be that change, you can be just that one voice that needs to be heard to effect the change. You never can tell who you're sitting with. That could be the key influencer. So use your voice, be more intentional, and speak up. Am I right, Dr. Badia?
That's right. I mean, we look. I I just had a discussion with the assistant of our wonderful county mayor here. I've been trying to meet for quite a while. And of course, she has a lot of other responsibilities, but this has been a decade-long process where just even at my community level, I'm trying to convey some of these issues because they just don't think of it at this level. It's not just a budget item. There is a reason why all of these things are more expensive. And we have to understand that. And part of it is your readers, if when they go to a physician or the hospital and they have some issue, and that issue maybe is related to something out of the doctor's power, we need to talk about it. You need to talk about it. You put it out there so that, because you'll see other patients will chime in and say, yeah, I had that experience too. And we need to talk about it. And this is what I'm trying to do at my own community level, because, you know, when I see patients on Mondays, I generally see the most patients. It's honestly a horror story for me. Okay, you got hurt at work. All right, where did you go? I went here. Then they sent me here. And I'm thinking, boy, that your fracture was a month ago, and I'm the first person in a month that's seeing you actually know something about the fracture. That doesn't make sense
at all.
It's like you coming to see me for your eye. Okay, I'm a doctor. I was even an emergency room doctor for a little bit in Manhattan to make ends meet. And I can tell you, I don't know a lot about the eye. I do not come to see me about your eye. And it's the same thing when you have back or shoulder or knee pain. You want to see the right person. And the system is not facilitating that. And we need to talk about it.
Right.
Because I hear it every Monday from patients. But it has to be talked about loudly, not to me, because I have the same frustration that you do, you know.
Exactly.
Mr. Patient.
Exactly. So thank you so much for that. And someone asked, I don't know if that's the right question. She actually said, how do you flanks Dr. Badia?
How do I flank?
FLANKS.
Maybe it was a typo.
Okay.
I think
so.
that sounds like a football maneuver as a running back.
All right. I think so.
I played rugby, not football, so I don't know how to flank. I think that might be a typo.
I think so too. All right. So all right. There's so many questions here, but you know, because of time, we would not be able to take all these questions. So we want to thank you. And please, guys, remember, you can purchase the book. It's titled, where is it? It's Healthcare from the Trenches. Healthcare from the Trenches. Go on Amazon right now and purchase that book. And for those doctors, those medical practitioners who have always had the mindset that it's not possible for you to become an entrepreneur at the same time being a physician. Now, Dr. Badia has come out to change that narrative. Henry Ford said, whether you think you can or think you can't, you are right. So it's a matter of you making up your mind, having a mindset of possibilities, you know. So thank you so much for today. You've shared so much. And I believe people will go and purchase that book. And you have encouraged people to use their voices, to speak up.
Yes.
Speak up about.
Now we have social media. This is a tool. You know, I'm seeing this with my children. This is a tool we did not have, you know, less than a decade ago. It's unbelievable how we can really impact society. But, you know, we have to realize there are things that are important as well, you know, including the main issues we've been discussing as society. But I mean, healthcare, I can't think of things that are much more important, especially when you or a loved one needs it.
That's true. That's true. So are you participating in telemedicine? Do you?
Oh, yes. Well before the pandemic, because many of my patients do come from abroad. So before they jump on a plane to see me, it's very smart for me to review their x-rays or MRIs, examine them remotely. You know, I say, you know, lift your shoulders, show me your external rotation, point to where it hurts. You can do a lot with telemedicine. And at least when they come to Miami, I already know what's going on. But we do this from around the country, not just internationally.
Oh, that's awesome.
Yeah, it is a
That's great.
great tool. Yes.
Yeah, so you're already ahead of the game, so which is quite good. Yeah, so for anyone who wants to get in touch with Dr. Badia, you can go to his website. It's Dr. Badia, DRBADIA.com. DRBADIA.com. You can also follow him on social media. Which social media would you want them to reach out to you on?
Yeah, the Instagram for my practice is Badia Hand, so at Badia Hand, and then also at Ortho Now, because Ortho Now is really the innovation of healthcare delivery. Is
Right.
walk in or the big center. So that one, and then there's Facebook Ortho Now. We're on Instagram. Shoot, I even did a little TikTok video that my that my medical assistant got me to do. It's quite funny. So we are trying to educate and learn. I love to learn from patients and colleagues who will write in. It's look, it's essentially a free platform. So this
Right.
is a great opportunity.
Right. So thank you so much, Dr. Badia. You have shared so much information today. I know you have touched the heart and souls of some other medical professionals here, and they will reach out to you. Now, those of you who want to collaborate with Dr. Badia, this is the best. You can go to his website. This is the best time to reach out
Yep.
to him, and
Yes.
he needs your support. He complained about lack of collaboration, and this is the time. He needs collaboration from all of you. So reach out to him, and probably you would be able to work out something. So thank you so much, Dr. Badia. And
Thank you.
now, would want you to just have a 1 minute advice for people out there. You know, a lot of people have been impacted one way or the other by the pandemic. Depression level is up there, anxiety level is up there. What's your advice for people right now? Just 1 minute before we go. How can they overcome this challenge we just went through? How can they move forward?
Well, I think in life it's always important to maintain perspective. So even though many of us were impacted adversely by this challenge, there's been many pandemics in much worse in history. I was reading a book from where I trained at Bellevue Hospital, and the things people overcame years ago without the benefit of drugs or real health care. And many overcame. So I think just maintain perspective. Um, keep working hard. Life is often a struggle, but that's what makes those moments bittersweet. Is when you work hard for what rewards you may gather for you and your loved ones. So I think keeping positive and maintaining perspective is very important, and don't lose hope.
Right. Thank you so much for those powerful words of encouragement. Don't lose hope. Do not lose hope. Every human being was born on purpose, with a purpose, and for a purpose. For as long as you are still alive, no matter what challenges you are going through, you are special. You have a purpose to fulfill in life, and that purpose has to be fulfilled. You are blessed. You are a masterpiece because you were created by the master. You're a masterpiece because you are a piece of the master. When there is life, there is hope. Keep doing your best. You are stronger than you think you are. And always remember that you are an abode of greatness. So thank you so much, Dr. Badia, for taking time out of your busy schedule. We've been here
Thank you,
for
John.
44 minutes. Really do appreciate you. And until next time, I hope you would, when next I call you, you would show up to talk about your book, how far you've gone with the book, and how far you've gone with the Congress and all those
There you go.
lawmakers. So thank you so much.
Thank you.